All right. So here you are watching Coblation tonsillectomy intracapsular. Sister, hold it like this. In a 7-year-old girl with obstructive symptoms, I am using Smith and Nephew plasma coblation at a setting of 9 for ablation and 4 for coagulation. So you can see with plasma we can melt the lymphoid tissues layer by layer, but will not go till the muscles, will remain in the lymphoid tissue and will reach the fascia but will not open up the fascia, so will not reach the muscles. If we do not open up the muscles, the child will not have pain and bleeding in the post-operative period. So very, very carefully, layer by layer, we'll remove the lymphoid tissues. This is the lymphoid tissue. We cannot leave behind lot of lymphoid tissues, otherwise the surgery will be incomplete. Now you can see that's the lymphoid tissue. That's the fascia. Can you see that? We have reached the fascia, but I have not opened up the fascia. That's the fascia. This is the lymphoid tissue, almost completely removed, and layer by layer, we are actually only reducing the lymphoid tissues. That's the lymphoid tissue. So I'm being very careful not to damage the pillar, because if we damage the pillar, then the surgery will not remain painless. If we damage the vessels, then the surgery will not remain bloodless. So we have to make sure that still the lymphoid tissue very carefully. That's the lower pole. I should not get inside the lower pole, because then the tonsillar artery will get opened up. Though my wand is facing the fossa, but I will not open up the muscles. Very carefully, layer by layer, there's still a little bit of lymphoid tissue here at the upper pole. This is still the lymphoid tissue which is covered with mucosa. Carefully, I will take away this lymphoid tissue. See, this is still the lymphoid tissue, so I am coagulating. If I try to ablate too much, the child will have pain, because I'll then enter the muscles. So now this is the last layer. Very, very gently. Now you can see I have reached the last layer, and once I have reached the last layer, I'll only coagulate. because our aim is to remove more than 95% of the tissue so that they do not recur, and the last layer, which is covering the uh, muscles, I have not exposed at all. So this is uh, intracapsular tonsillectomy, which will serve the purpose of tonsil reduction for completely. This is almost more than 95% removal of the lymphoid tissue, and rest of the tissues have been coagulated. So this will not regrow to give symptoms again. And just the last one, I'm coagulating. That's it. So this is going to be a bloodless and painless surgery for the child. Thank you for watching.